Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another edition of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypr.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the number one podcast for patient advocacy, education, and affirmation. This week, we bring you a guest, Dr. Nicole Rochester, who's a board-certified pediatrician, and most importantly, she is an independent health advocate, a TEDx and keynote speaker, as well as the CEO of Your GPS Doc. And I bring her on the show today to talk about this global pandemic disease, COVID-19, but most importantly, its effect on the African-American community. I can tell you, I've been having a chance to follow Dr. Nicole for the better part of the year. She is amazing at what she does, especially with her promotion of education and affirmation and empowering. Of course, you know, my motto, empower yourself better health. So this is definitely something that drew me to Dr. Nicole. But what really kind of took it over the top and what finally, allowed me to get her on the show was she did this amazing video discussion on the effects COVID-19 is having on the African-American community and how there's a lot of structural racism and a lot of other issues that have kind of led us to this point. And we kind of talked before the recording how most of us weren't really surprised by what was going on. You know, I think we were more surprised that more people were surprised that COVID-19 was affecting African-American communities at a much more significant rate than it was any other community. And when we think about it, and we'll talk about it throughout the show, we'll give multiple reasons why that is. Again, so Dr. Nicole, again, her big thing for us is she is committed to promoting health literacy and empowering patients and family caregivers across the globe. She blogs on a website, yourgpsdoc.com. Again, she is active on social media. She actually has this live weekly Facebook show that I want you guys to check out, Navigator Nuggets by Dr. Nicole. So definitely check that out. Again, I think you guys will be in for an amazing treat on today's episode here on the Lunch and Learn with Dr. Barry. And just remember, if you have not had a chance, remember to subscribe to the podcast, leave us a 5-star review and a comment to let us know how well we did on today's show, or honestly, how, let's say, even if you hated today's show, let us know that you hated today's show, that we know we can do and improve and get better for next week. So let's get ready for another amazing episode here with Dr. Nicole on the Lunch and Learn with Dr. Barry. This podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. At the store, you can get your favorite t-shirts, coffee mugs, even wristbands, and more. For a limited time, you can get 10% off your next purchase using the coupon code EMPOWER10. That's EMPOWER10, EMPOWER10. Just go to shop.drbarrypr.com to pick up your purchase and get 10% off today. And remember, 50% of your purchases will be donated to the 5-Star Scholarship Foundation, a nonprofit organization for high school students. All right, Lunch and Learn community, you just heard another amazing introduction by a guest who I've been ghost following for quite some time. I follow her on Instagram, I follow her on LinkedIn. I just subscribed to her YouTube page as well. And I watched a video of hers that really struck a chord with me, especially depending on when you listen to this. If you listen to this when it first comes out, or you listen to this 6 months later, we are kind of knee deep into the global pandemic that the coronavirus is causing. And, her video was just something that kind of struck me and said, you know what, I need to see if I could bring this expertise on the show, really to kind of give a different perspective. You guys hear me talk all the time, right? And I love to be able to bring my guests on to kind of give their perspective on what's kind of going around. So everything, especially here globally, especially here locally, and especially over, my communities of color. So Dr. Nicole, thank you for accepting the invite and joining the Lunch and Learn community.
Oh, you're welcome. Thanks for having me, Dr. Pierre. I'm excited.
So, Dr. Nicole, I always give your introductions on my introduction, and I have a lot of guests who love to speed right through it, right, to get right to the main show.
for those who sped through it or maybe to listen to it kind of haphazardly, what's something that, you'd want someone to know about you right before, if that's the case, they say, you know what, I like her bio, but like, I really like that factoid she kind of told us.
Yeah, I think probably one of the most interesting things about me is that I'm a board certified pediatrician who left clinical medicine, I guess now 2.5 years ago, to become an independent health advocate. And that's a field that really isn't very well known, even within the health community. And interestingly, it was sparked by my caregiving experience with my dad. So now, my clients are mostly either elderly individuals or the individuals that care for them. So it's like a complete transformation to go from my former obsession with the babies and kids and thinking I never would want to work with older adults. And now that's really the focus of my health advocacy practice.
And what I love is I definitely had a very opposite tone when I was going through my training, understanding that, kids are probably not going to be who I want to work with. And honestly, I don't even think it was really about the kids. I think it was the parents that did enough for me, especially I'm a father of 3. So I can only imagine me on the other side, bothering my pediatrician left or right. So that's why I said, let me go to internal medicine where they're older and most of the patients can speak back to me. That's the route I want to go. So when you had the transformation, I definitely want to talk about that, especially before we kind of get into the meat of our topic today. That transformation, especially dealing with your father, being the caretaker of your father, and kind of understanding, like, you know what, I don't like this side of the coin, right? And if I'm in the field, I'm in the business, and I'm kind of experiencing the way I'm experiencing, like, what made you say, you know what, I got to like step out there and.
Yeah. Honestly, it was pure frustration, anger, sadness. And like you said, what I kept saying to myself over and over again, I'm a physician. One of my older sisters is a nurse and has extensive background in like nurse administration. So and my other sister is not in medicine at all, but and the 3 of us care for our dad together. So 2 of the 3 of us had, a really solid medical background. And yet we still struggled often with, navigating my dad's care and most importantly, like advocating and getting him the things that he needed. And so what I started to realize after the first few months of caring for my dad is that when I would mention that I was a physician, or if in my conversation, maybe a term that I used would kind of let on that I was in the medical field, then suddenly I was taken much more seriously. And so each time I would successfully negotiate something that my dad needed purely because I was a doctor, it honestly pissed me off. And it just made me think about all the millions of other caregivers who don't have an MD or a DO after their name or an RN. And I just realized how unfair it was. And I kept thinking, if it's this difficult for me, and if, I'm asking questions that the average layperson doesn't even know to ask, I'm escalating matters because I work in hospitals and I know, that everybody has a boss. So I just felt compelled. I mean, after my dad passed away, I continued to work as a pediatric hospitalist, but I was forever changed. And I just kept honestly getting like these, what I would call like a spiritual calling, but I couldn't ignore it. I just kept getting this feeling that I was supposed to be doing something else. And like friends and family members would often kind of reach out and ask me questions about their loved one. And I would, give advice and then go back to what I was doing. And then I started realizing a pattern like, okay, Nicole, you actually have a gift in this area and you can help more than just your friends and family members.
I love it. And sometimes, especially in medicine, but we're just in life in general, sometimes we have this calling that like forces us to kind of move out of this comfort zone that we typically have. And again, yours happen to be kind of in the same field. And I'm pretty sure you have plenty of people who are really happy, right, that you made the change, right, which is always very satisfying when you make that leap that you were kind of scared to make. And then people are like, thank you for really getting out of your own way, accepting the fear that you had to go into, I guess, would it be kind of uncharted waters, like the process that you do now? Or was it like, did you have a mentor? Or what was that process that kind of moving in that direction?
Yeah, I didn't even, I knew what I wanted to do, but honestly, I didn't even know that there was kind of an established field. But once I started doing some research, I discovered that there are actually professional organizations for health advocacy. And actually in the last year and a half or so, there's now a board certification. So the field has kind of rapidly grown and developed since I've entered it. But at the time, I just did a lot of, I'm a Google queen. And I listened to a lot of podcasts in terms of like the business aspect and read a lot of books. And I didn't really have a formal mentor, but I definitely have had even other physician entrepreneurs who have poured into me and, business coaches and things that have really just kind of helped me with my mindset, which was very important. Leaving clinical medicine and going into entrepreneurship is huge.
Yes. And it's one where I love that I'm seeing more and more of our physician colleagues really make that leap because our training is, patient, take care of the patient, kind of head down focus. And I tell people all the time, like, they don't teach us as much business that's around us and as much business that is literally predicated on me signing a piece of paper. You would think that they would also teach me about the business surrounding that, but like it doesn't happen. So I love when I see my physician colleagues say, you know what, like I'm ready to expand and I'm ready to be just kind of more, shout out to Dr. Nee, more than a doc outside the box, right? Like I'm more to do that.
Yes.
Right? So definitely excited for everything that's kind of really going your way. And obviously here at Lunch Learning Community, we love our physicians who do that. Especially our health advocates, right? Because a big thing for us is, empower yourself for better health, right? And that's what you do, right? You're about empowering, and getting someone to that next level that sometimes there's roadblocks that they don't even realize the roadblocks are in front of them.
That's exactly right.
And what's interesting, especially kind of this segue, right? Because I love the segues. When I came across your video and I watched it and I was like, okay, yes, I need Dr. Nicole to come talk to the Lunch Learning Community because there's a lot of information going out right now. Again, depending on when you're listening to this, as far as this global pandemic, right? The coronavirus, right? Again, if this is your first time listening to the Lunch Learning Community, we've talked about this ad nauseum. So we're just going to kind of assume you kind of know at least skeleton-wise what the coronavirus is, right? Unless some way you've been able to avoid TV, avoid radio, avoid the internet. Like somehow, if you've somehow been able to do all of that, then one, God bless you, right? And two, we're just going to assume that you do, right? But now we're starting to get a lot more reports, right? And this is some information that we've kind of been asking for. We as kind of health professionals have been kind of asking for, like, all right, what does the data show as far as who is affected by the coronavirus and who is more at risk for it, right? Because that's the question. That's the $1 million question that everyone wants to know. Who is at risk for this disease? And we're starting to get more and more information that says that if you're a person of color, specifically African-American, you might not do well, right, with the coronavirus. First of all, what are your thoughts on that, right? Well, let's get I want to kind of get your thoughts on that before we kind of go in, tease out, the information that's there.
Well, like you and I talked about a little bit offline, I was not surprised. You weren't surprised. I weren't surprised. Most of our physicians of color were not surprised. And, it was almost like we were waiting to get the data, but we already kind of knew ahead of time. I mean, I was definitely saddened. Even though I wasn't surprised, I was very saddened to hear the statistics, especially the degree to which African Americans are being disproportionately impacted. And I think for me, what made me even more sad was to hear from some colleagues that described, difficulties with African Americans being tested. And, that just made me put on my health advocacy hat and, knowing that, you have to meet certain criteria and even, having to have a primary care doctor. Well, not everybody has a primary care doctor. So, not only are we more at risk because of how we tend to have more heart disease and asthma and obesity and, all the other pre-existing conditions, but just the very nature in which we encounter the healthcare system and the implicit bias that we know exists and how, we often are not listened to in medical settings, just really caused me to have great alarm during this pandemic.
That's interesting. I had prior guest, Dr. Kristen, who and we talked about kind of the implicit bias really associated with the coronavirus. And at that time, we were just really talking about really, how the Asian community was being affected. And this is before all of the African-American stuff kind of came out. Mm-hmm. Just the stigma, like they were now getting the stigma of the coronavirus kind of being placed on them and some of their experiences they were getting. And then the news starts coming out, right? Starts coming out where, and for some reason in this city, even though it only makes up 40%, almost 70% of the people are dying who happen to be African American. And then you start seeing more and more similar numbers in different cities. And again, I think I was, we talked about before, I think I was more shocked that people were more shocked at the rate. And you kind of touched on it before, and you, obviously we're talking about the coronavirus now, but you talked about, asthma and obesity and diabetes and hypertension, all these other things there, which I think a lot of times people don't realize are the end products of issues more than the primary source on it. And I loved in your video when you talked about that. You talked about why unfortunately we're looking at the end result, aka what coronavirus is, but not looking at what's unfortunately putting especially people of our communities at a much more higher risk to deal with that.
Absolutely. Yeah. I mean, we blame African Americans for being obese, but we place them in communities where there are food deserts. They don't have fresh, farmers markets, and they don't have fresh vegetables and fruits. And if they have it in their community, if they're blessed enough to have a real grocery store and not just a corner store, then who can afford that? I know when I go to the grocery store, and I my salary is okay. But, sometimes I'm looking at the organic versus the non-organic, or, the things that are the healthiest foods for us cost a lot more money. And that's all by design. So they don't have access to the healthy foods or they cannot afford those healthier options. And then we have, lack of green spaces, lack of safe spaces. And so, we blame them for lack of exercise and things like that. All the things that contribute to the obesity epidemic among African American communities. The same argument can be made for diabetes and heart disease. And so, I just find that we tend to blame the victim, and we often don't acknowledge, or others often don't acknowledge, all of the societal, policies and all of the things that have gone into why we are where we are today.
And what's interesting, and I ask you, especially in your setting where you're at now as the advocate you are, what has been some of the, I guess, some of the hurdles that you've had to help people kind of climb over, right, to get them to this realization, right? Because obviously, again, a lot of us we're here. We were on this other side, just kind of waiting for people to come on. But what were some of the hurdles that you had to help people get over for them to realize, wow, okay, well, that's all right. I get your point. I can see how y'all would be much more disproportionately affected by this disease, whatever this disease is, than others.
You're asking what kind of hurdles I've had to get the individuals over? Mm-hmm. Yeah, I mean, I think a lot of it, my biggest thing when I'm working with clients is helping to empower them. I think a lot of people don't see their role as being integral on the healthcare team, particularly in minority communities. And a lot of times, not that they trust the doctor necessarily, but they do still kind of put doctors and nurses and other healthcare professionals on a pedestal. And so that in doing so, they kind of give up some of their inherent power. And so I spend a lot of time helping individuals understand that you really are in control of your health. You have a lot more power than you think. And that just because you don't have a medical degree, just because you didn't, you don't have all these letters after your name, you still know your body better than anyone else. And you should know your health conditions better than anyone else. So I really try to empower my clients to become intimately familiar with their own health conditions, with their risks for health conditions, with their medications, the side effects, everything related to their health. Because I find that when you present in that medical setting, and when it's obvious that you have knowledge, about your condition, when you can speak relatively intelligently, you are treated differently than the person that says, well, I don't know, or, being very vague about symptoms. And that's just a fact. You're taken much more seriously when you come across as someone who is knowledgeable, when you come across as someone who is invested in your own care, when you ask questions, all of these things are really important. And, they are playing a role, I think, when it comes to the coronavirus pandemic as well.
And you mentioned as far as, and I love the relationship when you talked about making sure that we understood the difference between what health equality was versus health equity, right?
Yeah.
Can you kind of expound upon that, especially for the lunch learning community, so we can kind of make sure our minds are fully wrapped around it and understanding that, like, what our goals really should be, especially when we're trying to empower ourselves and, get ourselves, healthy?
Yeah, absolutely. So health equality versus health equity. With health equality, it's everybody being given the exact same thing. And this kind of goes to this, with the thought that, well, you all have the same access as me, or you have this, or we're all Americans, all these falsehoods that we hear.
Very, very.
So that's this concept that everybody is just given the same thing. And then health equity really means I'm going to give you what you need so that you can achieve your optimal health. So the example I gave in the video was, there's a lot of graphics, but there's a picture of, a tall tree with fruit on it. And if you picture a tall man, an average sized woman, and a kid, and, the tall man could stand under that tree and just reach his arm up and grab all the fruit he needs, or at least the low-lying fruit, right? But that lady is, maybe 6 inches or more shorter than him. She can jump up and reach all she wants. She's not going to get that fruit. So she needs to be provided with some help, a little step stool. And the kid may need, somebody to actually carry him, put him on their shoulders, or maybe he needs to stand up on 5 crates, in order to be at the same height. And so that's the health equity, where you can see, the guy is just standing on his own feet. The woman maybe is on a stool and the kid is on 3 boxes. So at the end, they're all at a level playing field. And that really is the issue with health disparities in the United States, is that we are not on a level playing field. We have never been on a level playing field. And in 2020, we still are not. And so we can't expect the person who is, feet away from the fruit and then blame them. Why aren't you getting the fruit? And that's what we do. What's your problem?
Like, what's your problem? Just eat. It's right there. Like, just grab it. Like,
the tree is right there.
Yeah, it's like, well, just jump. Like, can't you just get it? Like, see me, look, that's
right.
Hilarious. So 2020 comes, right? We're in 2020 and we've been hit with a global pandemic, with a virus that we're not sure where it started. We're not sure where it came from, maybe kind of where it came from, but it's here, right? And it's affecting across the country. And when we talk about just kind of the health disparities that are kind of put in front of us, right, that, allow some of the discrepancies, right? And the lunch learning community, when we talk about discrepancies, again, I kind of mentioned it, you have communities where maybe the population of African-Americans, are less than 20%, less than 50%, but they're making up a majority of the cases of the coronavirus, right? That percent makes absolutely no sense in that sense there. Can you talk about what are some of kind of the structural, roadblocks that are in our way that are kind of leading up to these kind of health disparities, especially when we talk about the coronavirus? It's like, what are some of the things that and unfortunately have been affecting us that have not allowed us to get the type of care that we should be getting?
Well, if we start with why are we even disproportionately impacted? Because you have exposure, then you have infection, and then you have, who gets sick, when they're infected, and then who's dying. And just exposure wise, again, I think about my own privileged life. I've been working from home I work from home anyway, but, I'm able to work from home. Many of my friends and family members are able to work from home. Well, many people in the African-American community are employed in the types of positions and industries where they don't have the luxury of just staying home. So even at the crux of, the advice is social distancing, stay home, stay 6 feet apart. Many people aren't able to do that. And so, if you are driving, for public transportation, or if you're a factory worker or you work in a grocery store or whatever, you don't have that luxury of just quitting your job and staying home and not having an income for your family. Or, even we've talked about some of the recommendations. If someone in your home becomes sick, or if you become sick, go isolate yourself. They want you to have your own bedroom, your own bathroom. Well, that's assuming that we all live in, 4 or 5 bedroom homes with multiple bathrooms and a separate basement where somebody can go quarantine themselves. If you're in a 1 bedroom apartment with 5 people, everybody's going to get it. If one person gets it, that whole family is going to be impacted. So, that has to do with kind of like the exposure and the infection. And then when it comes to, treatment or even being tested, a lot of times you had to have an order from your physician. Well, yeah, you can go to the ER, but they're telling us to stay home. And the African-American community is listening to this. They don't want to go to the ER. They don't want to be around the sicker people. So what if you don't have a primary care doctor? How do you even, if you wake up with a cough or you're feeling a little short of breath, you have a fever, if you don't have a primary care doctor, how are you going to get that order to get tested? I talked on my video about drive-in sites. Well, what if you don't own a car? And then a lot of the testing sites have, in my opinion, strategically been placed in the more wealthy, more affluent, white neighborhoods. And so, many in our community don't even really have easy access to the testing. I've heard from individuals who have said that people were turned away, people with classic COVID-19. Let me be more clear. African Americans with clear COVID-19 symptoms have been turned away and have been told that you don't need a test. And then you think about if you are sick enough to present to the emergency room, or even if you're hospitalized, are you being treated differently? Are we being offered some of the experimental therapies? Are we being enrolled in clinical trials? Are we able to really advocate for ourselves? Do we even know to ask for those certain things? Are we being sent home with the vital signs that maybe someone else would be kept for? There's all these steps that go into proper management for coronavirus. And I'm just very worried that African Americans, in addition to all the barriers we've already talked about, that even when they present for care, are we getting the same care? And if we use, pain, and if we use cancer and all, if we use all the other examples and the studies that have already been done that show that African American patients with the exact same disease, the same presentation, are not given adequate therapy, then I have to presume that same thing is happening with coronavirus.
I love that you broke it down in really those 3 separate stages that you can see that where we would fall out in multiple stages. As a hospitalist physician, for those who may not know, lunchtime community members, like when you go to the hospital, right? Like, cause I see you, hopefully when the ER doc says, you know what, this is the person I should test. But a lot of times you're alone, right? And the reason why you're alone, one, is because most hospitals aren't even allowing visitors to come to the hospital anymore. So you have solely been thrown into the position of your own personal health advocate.
That's right.
And imagine being in a world where you can't rely on a family member who's typically right there, typically is very knowledgeable, typically knows, like, no, you need to say it this way versus that way. Because imagine that position. That's what patients across the country are being thrown into. And that starts in the beginning, right? That starts when, the lack of education, the lack of, kind of knowing that you needed to be your own personal self, right? And which is why I was so drawn to you. Because you like, again, I'm all about power yourself for better health, and you're all about that, right? So I was like, okay, yeah, this is like a match made in heaven. Like, I gotta have on the show, and seeing the many, and lunchtime community heard the many different stages that you can fall out, and it's clear. It's not even like we're not even like hypothesizing anymore. It's clear that we are falling out in a lot of these different stages, right? You pick one, we're falling out, right?
Yes.
And that's why I like to be this kind of the sounding board. And again, that's why I want to kind of amplify your voice as kind of screaming from the rooftops. Like, we need to be in charge of our own self, because clearly, right, the system is unfortunately not designed for us in this state of healthcare. And you kind of mentioned it, right, where there's this lack of trust, right? We can go all the way back to Harry Relax, the syphilis experience. Like one thing we have is very good memory, right? Yes. So we remember when we weren't treated fairly, and we remember when we were just treated as experiments. We remember all of that. And we get that type of message gets passed on, and that type of practice gets passed on. And unfortunately, in 2020, we are being, severely affected by it.
Absolutely.
From your perspective, right? Knowing that, I guess now that the world knows, right? I guess for some reason it must have been our kind of dirty secret that people of color were going to be affected much more by the coronavirus than everyone else. Right now, for some reason, the world is like woken up, right? What do we do now, right? Like, what do we do to try to? And I guess I have a twofold question. What do we do to try to right the ship, and do you feel it's even possible? Right. So I guess just to put you on the spot, right? Like, let's.
Well, is it possible? I have to believe. I am generally a very optimistic person, even in spite of everything that we're going through right now. And I just have to believe that we can at least partially right the ship. I refuse to believe that there is nothing that we can do. But you and I know, it didn't take 5 years or 6 months to get to where we are. And so, it's going to take many, many more years, maybe not even in our lifetime, before, there really is true equity in healthcare. But there definitely are some things that everyone can do, particularly communities of color. And, I talked about this in my video. I like to use the GPS system, and it's literally 3 things that every single person can do during this coronavirus pandemic and beyond to really advocate for yourself and for your family members. And the G is to gather information. So, this is not a time when you can be a passive bystander in your healthcare. You cannot necessarily trust that the person on the other side of that stethoscope has your best interests at heart. And I'm not trying to create, mistrust, because most doctors really, really want to do the right thing. Let me just make that very clear before we go further. I'm a physician. I love physicians. I love my colleagues, and most really want to do the right thing. But we know that doctors and healthcare providers are extremely stressed out right now in light of this coronavirus pandemic. Resources are being stretched, and we know that there's implicit bias. So no matter how good of a person you think you are, there are subconscious things going on that you're not even aware of that may impact how well you're listening to the person in front of you and the decisions that you're making. So the gathering of information is really just, asking questions, always asking questions, and not just accepting that first answer. Being very clear, asking, like I gave examples, if you're in the hospital, if you're in the ER and they're saying you can go home, then you want to ask questions. Okay, doctor, what is my heart rate? What is my respiratory rate? What is my pulse ox? What is a normal pulse ox? Or, and if they're telling you your pulse ox is 92 and you can go home, then you need, okay, what's normal? Well, you just told me 97, 98 is normal. Why is 92 okay? And you just need to constantly ask questions and really become as educated as you can about the coronavirus, about, when you need to be hospitalized, if you're being sent home, what do you need to be doing in your home to care for yourself? What are the things you need to look out for so that you can go back? Because a lot of times I hear, from people that, well, the doctor said I was fine. Well, you were fine in that moment, but that doesn't mean if you get worse the next day or, even 6 hours later that you just sit in your house. Like, you need to know, what are the things that I need to look out for and what should concern me? When should I call? When should I call 911? When should I go back to the hospital? So the gathering of information is extremely important. And then the P is to position yourself as an expert. And this goes back to what I was saying, is that you need to be the expert in your own healthcare, your own body, your own medical conditions. So if you're somebody who doesn't know the names of the medications that you take, if you don't know the health conditions that you have, now is a great time to brush up on all of that information, because we know that certain individuals are at increased risk. And so the doctors are relying on your history, the information that you provide, to decide, are you in a high risk category? Or are you in a lower risk category? I would hate that somebody would be sent home from the ER because they didn't know to say that they had heart surgery, when they were 8 years old, or that they have diabetes, or, kidney disease, or any other problem. So we really have to make sure that we are intimately familiar with our own health conditions so that we can position ourselves as an expert when we are, in those medical settings. And then the S is to stand up for yourself, which is probably the most important thing that I can share is, again, you're the expert. And so you have to trust your gut. You have to actively engage. And if something doesn't make sense, you need to ask questions, explain it. And if you don't agree, or if you're not sure, you can't just shrink and back down and say, oh, well, they're the doctor or they're the nurse, I'm just the patient. Now more than ever, we really have to be strong advocates for ourselves and our family members, and really make sure that you are not leaving that encounter until you are completely comfortable with all of the information that you've been given, with, knowing how you're going to manage your care if you're not being kept in the hospital. So, it's a huge burden to bear, but now more than ever, we have to take that on. We cannot just relinquish that responsibility to others who, just may not have our best interests at heart, or may be so distracted and burned out and all the other things that, they're just not able to provide the best care.
I love it. And first of all, I actually love all three pillars. When you're working with patients, and when you're just talking to patients and clients and family members, is there any one of those pillars that you see, especially, people of color in the African-American community tend to falter one more than the other? Or is it just kind of like this combination where we're all just down bad for?
Yeah. I think probably, it depends, honestly, because my clients have, they vary in terms of their ethnicity, in terms of their socioeconomic status. But I think a lot of people fall short with the positioning yourself as an expert. A lot of times they don't know the names of procedures that they had, or they don't know the names of the medications, or they're not familiar with, certain side effects. And so those are all the things that really kind of help you really be at the center of your own medical team. And so I think the education part is often lacking. Honestly, I think it's all three, because a lot of times I find that people, they don't want to ask questions, particularly the older generation. They are very respectful, and they'll say things like, well, I didn't want to bother him, or, he had already answered it once, but I didn't understand. Or they don't want to appear to be, silly, or I didn't want to look dumb. And so a lot of times, they're pretending in the office that they understand. And my dad used to do this. It drove me crazy. Before I was formally his caregiver, he would go to the doctors, and then he'd come home, and I'd call him up and say, hey, Daddy, what did the doctor say?
Oh, man.
And he'd be absolutely clueless. And I'm like, what do you mean? Well, he said he's going to start me on something, but I can't remember the name of it. And he said I need some test, but I don't. And I'm like, why didn't you ask him? Why did you leave that exam room without, making sure that you clearly understood? So because
I used to do outpatient medicine before I went into inpatient. And that was one of the things I realized very quickly out of residency, is that I would walk out the room and say, oh, by the way, tell me what I just said. And then the blank look on some of my patients' face, I'm like, you know what we're going to do for you, right? And then I'm like, okay, hold on, let me go over again. I was genuinely shocked and surprised how many people will leave your office and have no clue what y'all talked about. Even though you could, and we're not talking about oh, I was only in there 2 minutes. No, I could be in there 15 minutes, 20 minutes, and it didn't matter. The second they leave, it's as they're just, all right, I don't know what happened, but.
Exactly. And that's why I really encourage people to take notes, either in a notebook or on your smartphone or your tablet, because we know that I think there's some statistics that say like 15% of the information, that people only retain about 15% of the information. And if you pair that up with stress, I mean, if you're going in like now, I mean, if you're going to the doctor for suspected coronavirus, or if you're in the hospital, you have all that stress and worry and anxiety, and that's going to really impact the amount of information that you're able to retain. And so I always recommend that my clients write every single thing down so that afterwards they can look back over their notes and kind of refresh their memory. Some people like to record visits, but yeah, you're right. I mean, they don't remember a lot, but then they're also reluctant to just be honest. And so I kudos to you for doing the teach back. Again, these are techniques that we all learn in medical school, to teach back, to ask the patient and their family, okay, what did I just say? What are you going to do if this particular, but in reality, we don't even have time to talk about the healthcare system and all the flaws, but the doctors,
another show. We can do another show.
Yeah. They don't have the time to be able to employ all of these techniques that we know have been shown to, improve health literacy. And that's why I'm saying it just takes us back to what we were just saying. That's why it's so important that the patient takes on some of that responsibility, because, the doctors just can't. They literally cannot.
So, Dr. Nicole, first of all, I want to thank you for really imparting a lot of words of wisdom today. I know my lunchroom community is actually absolutely floored by just kind of like your because we can hear the passion that you have when speaking on the need to be empowered, the need to be your own advocate, right? So definitely want to, first of all, thank you for that aspect and really just kind of imparting your education here on Lunch and Community. Before you go though, right? Because I love my Lunch and Community members that kind of always follow my guests and see what my guests are doing. We kind of talked about it in the beginning, right? So right now, you work from home, you're a patient advocate, caretaker advocate. What are some of the things that, where can people find you? Obviously, again, like I said, I was Community. I was ghost following her on, I think Facebook and Instagram. Cause she like literally Community, especially those who follow me, I post a lot, and she every time I'm like, yep, that's another one. Okay. Which I absolutely love. Again, absolutely love it. Where can people find you, follow you, hear your message? Obviously, the video that we were kind of referencing throughout the show, Legendary Community, it will be in the show notes, because I need you to go to her YouTube page. I need you to subscribe to her YouTube page. I need you to like and comment on that video, because like I said, it was a phenomenal video as well. So where can people track you down, hawk you down, and what's next for you?
Well, thank you. I let me just say again, thank you so much for having me on your show, which is an amazing show. I've been ghost following you too, and really following your guests. So I appreciate the opportunity. I'm on social media as your GPS doc. So Facebook, Instagram, and Twitter. They can find me, your GPS doc. My website is www.yourgpsdoc.com. I'm on LinkedIn. They can just search Nicole Rochester. I have a TEDx talk. You can find that out there. And I wrote a book for college students, helping them navigate the healthcare system. That's available on Amazon. You can also find that on my website. But yeah, I would love for your listeners to engage with me. I would say Facebook is probably my primary platform. Okay. I'm trying on Instagram, but Facebook is my primary social media platform, and LinkedIn as well.
Now, do you have a scheduled time where you typically go on and talk on Facebook, or is it just?
Oh, yes. Thank you. Yes. So every Monday night at 8:00 p.m. Eastern Standard Time, I have a show called Navigator Nuggets on Facebook Live. And then those videos are being uploaded to my YouTube channel. So yeah, I invite your audience to join me Monday nights at 8:00 p.m. Eastern Time. And, since March 2nd, every single episode has been devoted to coronavirus. And I guess I'll continue that for now, but with a twist, always, focusing on how individuals can navigate the healthcare system. So we've talked about what to do if you lost your health insurance as a result of coronavirus. We've talked about caregivers, and like you mentioned, no visitors. So how do you effectively advocate remotely when you can't be at that bedside?
Ooh, that's a good one. Very good one.
Yeah. So those are some of the topics we've covered so far.
All right. Thank you again, Dr. Nicole. Thank you for such an amazing episode. Again, Lunch Learning community members, make sure you follow her. Again, she's great person to listen to, especially if you're about what we about here in the Lunch Learning community, right? When you're trying to empower yourself, make sure that your health is the number one priority, especially when a global pandemic is around us. And it's causing a lot more people to really like, I really need to make sure my health, like the amount of people who are suddenly like enthralled with their health care and want to make sure, their health is their wealth. Like again, however you come to us, we welcome you with open arms. So we'll just say that. Now we've been waiting for you.
That's right.
Dr. Nicole, thank you again for joining us here on the Lunch and Learn community.
Thank you. This was great.
Thank you for coming to the end of the episode. It is yours truly, Dr. Barry Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lunch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222. And you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.